Confidentiality means that you must respect the patient's privacy and autonomy and cannot reveal any medical information you learned while treating the patient. How would you approach disclosing information to a patient's family and friends? Always remember that disclosing information to family and friends should be guided by what the patient would want. Also, the patient may waive the right to confidentiality, which often occurs with insurance companies. Again, for the purposes of the board, it's more important to know about the exceptions to confidentiality as opposed to confidentiality itself. Now, if the potential harm to others is serious, or if the likelihood of harm to self is great, then the patient's right to confidentiality is no longer valid. This encompasses threats of homicide or suicide. Moreover, if no alternative means exist to warn or to protect those at risk, then the patient's right to confidentiality is no longer valid. In these situations, you may be required actually to take steps to prevent harm to the patient or others. Now, can you think of some examples in which these exceptions would come into play? These exceptions would be relevant for certain infectious diseases such as HIV, in which physicians may have a duty to warn public officials and identifiable people at risk. Also in cases of child or elder abuse, impaired automobile drivers, and suicidal or homicidal patients, these exceptions might apply. One important Supreme Court decision that you should know about is the Tarasov decision. This decision set the precedent for the physician to directly inform and protect a potential victim from harm. Now, the board loves to present questions concerning ethical decision making. This is an extremely high-yield topic to review, but given the number of potential situations that could be presented, it's difficult to cover every possible ethical dilemma you could be presented with. So to review this material, it's best to understand a few general principles and then apply them to diverse situations that may arise. In general, going to a superior, a court, or to the ethics committee will not be the correct answers. Furthermore, should you ever refer the patient to another physician? No, the answer is almost never, regardless of the situation presented. When given the answer choice to refer the patient to someone else, there's always going to be a better answer choice listed, because the test makers believe that the original physician should handle all of the ethical situations, and referrals are unnecessary and unprofessional. Now, this is good for the boards, but not as applicable for the wards where referrals and consults are actually pretty common. Patients' wishes and their comfort actually come first, and they supersede those of orders that may come from, an attending or some other superior. Competent patients have the right to refuse procedures, as we've discussed before. Finally, getting enough information and asking open-ended questions before taking any action is a good rule to remember for the USMLE. So let's go through some examples now. What should you do if a patient is not adherent to treatment? The best response is to try to identify the patient's reasons for noncompliance and determine their willingness to change their behavior. Do not refer this patient to another physician. As an example of patient non-adherence, if a patient continues to smoke, which is actually pretty common, although, not as common as it used to be, given repeated counseling sessions, the appropriate response is to ask the patient how they feel about smoking and then offer advice on cessation if they express an interest in quitting. What about medical noncompliance? If a patient is having difficulty taking their medication, the appropriate response is to provide written instructions and attempt to simplify the treatment regimens. So another common case scenario is when family members ask for information regarding a patient's progress. What ethical principle would this violate? Of course, patient confidentiality. The appropriate response here is to avoid discussing these issues with relatives without the explicit permission from the patient. However, do not choose an answer that seems rude or off-putting. What if a child wishes to know more about his illness? Well, the appropriate response is to first ask the parents what they have told the child about the illness, because the parents of a child decide what information can be relayed. Pregnancy is another high-yield ethical situation to review. If a minor is pregnant and requires an abortion, the appropriate action is to not advise the patient to have an abortion regardless of her age or the condition of her fetus unless she is at medical risk. Also remember that many states require parental notification or consent for minors to have an abortion. Another scenario is that a minor is pregnant and wants to keep the child, but the parents want her to give the child up for adoption. The correct action here is to provide information to the patient about the practical issues about caring for the baby and discuss the options with her if requested. Also, you should encourage open dialogue between the patient and the parent. The key here is to remember that the patient always retains the right to make decisions for her child, regardless of whether or not the parents agree or disagree. Thus, the parents can never force their child into giving the child up for adoption. Another topic to review is suicide. If a terminally ill patient requests assistance in ending his life, you must always refuse involvement for the purposes of the boards. However, physicians may prescribe medically appropriate analgesics for pain control, even if it happens to shorten a patient's life. So how do you think you should approach an interaction with a patient who is suicidal? If a patient is suicidal, you must assess the seriousness of the threat and suggest that the patient remain in the hospital voluntarily. Remember that in these situations, the patient can be hospitalized involuntarily only if he or she refuses to be admitted and you are deeming them to lack decision-making capacity. In scenarios where a patient states that he or she finds you attractive, romantic relationships with patients are never appropriate. Never tell the patient that there can be no relationship while he or she is a patient. Obviously, this simply implies that a relationship would be possible if the individual is no longer a patient. In these situations, ask direct, close-ended questions and use a chaperone if necessary. If a patient ever states that they feel ugly, find out why the patient feels this way, but do not offer false reassuring statements like, "You still look good." These are trap answer choices and will always be incorrect. The appropriate way to respond to a patient who is angry about the amount of time he spent in the waiting room is to acknowledge the patient's anger without taking it personally. You should apologize for any inconvenience, but you should stay away from your efforts to explain the delay. So what if a patient is upset with the way he was treated by another doctor? The appropriate response here is to suggest that the patient speak directly to that physician regarding his concerns. If the problem is with a member of your office staff, tell the patient you will speak to that individual yourself. What happens when a physician makes a medical error? Regardless of how serious or trivial the error is, the physician is ethically obligated to inform the patient that a mistake has been made. If a patient requires a treatment that is not covered by his insurance, you should never limit or deny care because of the expense in time or money. Discuss all treatment options with the patient, even if some are not covered by the insurance companies. Remember that there is a history in this and other developed countries of unethical medical practices, especially in disadvantaged populations. It is your job as future physicians to always be on guard against this and to make sure your patients get the best ethical medical treatment possible, regardless of race, gender, sexuality, or any other categorization. Okay, that was a lot. Let's do another flash quiz. A patient's doctor approaches you in the hallway outside the hospital room. She is crying. She asks you to please don't tell my father anything about his diagnosis. Please don't distress him. What should you do? Ask the daughter further about her concerns and find out why she wishes the diagnosis to be withheld. Never be rude, brusque, or dismissive, but also do not agree to withhold information. You may offer to discuss this with the patient and patient's family members together. Address the family member's concerns and gracefully explain your obligation as a physician to the patient.